Well, I'd like to welcome everybody to the Medical Marijuana and Awareness Wellness Seminars. The seminar series is here to really help you and get your questions answered and to really demystify a lot of using medical cannabis, medical marijuana. This is our summer series, the first of 4. We'll be talking about the other webinars we're having this summer. But more importantly, there's something that we're trying to accomplish here. And this seminar series is really tagged, I got my life back. And that's what a lot of people tell us from the information that they get here. So if you have questions, please bring them up. What you'll notice at the bottom of your screen, a little bit to the right, you'll see a button that says Q&A. If you have questions, please click on that. We'll be more than happy to answer those questions. And then also, we do monitor chats, but we mainly pay attention to the questions, and we'll get those answered either during the webinar or after the webinar, but we'll get your questions answered. We're here really to be able to help you demystify the process of dosing. Dosing is very important. Finding your sweet spot is really critical to really being successful with your medical cannabis experience. And it's something that's been difficult for a lot of people. So please feel free to express yourself. Now, tonight, I'm honored to have 2 people that I think really help us bring the subject to bear. I'd like to introduce both Turner Davis and Sarah Mitchell. I'd like to initially introduce Sarah. Sarah, you're with Trulieve, and you do a lot of education. Is that right?
Yes, Mark. So my name is Sarah Mitchell, and like you mentioned, I am with Trulieve. I'm a community educator, and essentially the main pillar of my job is to educate medical marijuana physicians throughout the Panhandle, Tallahassee, and Gainesville. So really thrilled to be here. Thank you for having me. Like you mentioned, it's a very important subject matter, so thrilled to be here. Thank you guys so much for having us.
We appreciate it. And the other is Turner Davis. Turner, tell us a little bit about yourself and what you bring to the party. You're kind of the main man tonight with respect to discussing dosing.
Yeah, hey, thanks, Mark. Yeah, my name's Turner Davis. I'm a pharmacist, been a pharmacist in Florida for about 20 years. Got into working in the medical cannabis industry around 2012, 2013 or so as the rules first started to come to fruition, and have been fortunate enough to be able to work with physicians in Florida with MMTC and really help educate and help patients to understand how marijuana can work as a medicine. And that's really kind of, what I'm going to talk about tonight, as well as, how to get the most out of it, what the side effects, what to expect, those sorts of things. So yeah, no, I appreciate being here, and I always appreciate the opportunity to educate. So. Well,
and you work with, you have 25 clinics, medical marijuana clinics with doctors, and you've treated literally, I would say, thousands of patients. Is that correct?
Yeah, no, we have. We were fortunate enough to get established really early in the process, and have really become one of the leaders in Florida as far as from the medical and physician and education side. Have qualified over, I think we're 50,000 patients now over the last 5 years or so. So really have had a lot of experience in from one end of the spectrum to the other as far as responses for cannabis, how patients respond, how patients can improve their quality of life. And so really, that's really kind of what we want to bring to the table tonight is to understand how best to accomplish that without, functioning, improving quality of life, and avoiding side effects that you may or may not want. So,
yeah. You and I have had a lot of discussions on the subject, so that's why the seminar got put together, because I think it's the key to a lot of people being successful. So let's kind of, if you don't mind, I want to kind of jump right in and let's get down to the actual slides themselves and what we can do. I should mention that we are doing, this is part of the Canna Chat series. The dosing is the webinar this week. In 2 weeks, or excuse me, in a week, we're doing one on how does medical marijuana work. I think a lot of people hear about it and they wonder, what is it? How does it work? How's it going to work for me? And that's what our subject is next week. And then we're doing a webinar 2 weeks after that on pain management, and then 2 weeks after that on anxiety and stress. And so that'll take us through the summer, and then we'll start again in the summer with our fall series. But please feel free to sign up at marijuanaaware.com for any of these particular webinars. And I do want to mention that tonight's webinar is being live streamed on Facebook. So what's going to happen after this webinar is you'll get an email from us that will give you a link to the video, and give you a link to the presentation, and also to any references and any reference material that's there. That'll be out probably late Friday afternoon. But the YouTube video, excuse me, the Facebook video will be out there tonight. So if people want to be able to look at it and review it, you'll be able to get there. And again, we will send you a document or an email so that you'll be able to find these very easily. If you have friends or if you want to refer to it, please do. And that's what they're there for. So let's chat about dosing for a moment. And I've been in this business for about 8 years, and I think this is probably the most important subject that you can discuss when it comes to medical cannabis. Finding the right dosing is absolutely critical. If you can get it right, it becomes a wonderful experience. And if you don't get it right, you either quit or don't have a positive experience. And it's really not difficult to find your sweet spot, but a lot of people haven't been given the formula to be able to do that, which is what we're planning to do tonight. So the common feedback that at least I've heard, and maybe Turner and Sarah, you've heard, is, you know, it didn't work. You know, I tried it, so I quit, and that's legitimate. And also, I feel high, so therefore I felt uncomfortable. I had an uncomfortable experience, so they're not positive about it, or they may even quit themselves. You know, some people say it works, but I hope it would do more than it has done. That's one of the comments that we hear a lot, quite a bit. One of the ones I really love is, you know, why can't I just smoke a joint and get the relief I want? You know, I mean, people who have smoked joints and not getting the relief they want are frustrated, and we'll answer a little bit of that tonight. Not a little bit, a lot of that. And then the other question is, where do I go to get help with dosing? That's always a big subject. That's been kind of the mysteries that's out there. So those are the questions that we plan to have answered tonight. If there's any questions that you have that you want to have answered, please put it in the Q&A button. We'll be more than happy to answer that for you and be able to move that forward. One of the things that's important, in turn, I'm going to let you speak a little bit on this, is that every person's body is different. What makes cannabis unique is it's not like a pharma product where you take 2 pills and I'll see you in the morning. There's no canned regimen. I get a lot of people that say, what should I do here? What should I do there? And the answer really is you have to answer your own question, because it has to do with your own body. And I liken it to alcohol or caffeine. You know, everybody has a different tolerance for alcohol. You know, I have friends who have 1 drink and they're done for the night. And I have other friends that can drink the whole bottle and they're just getting going. And that has to do with their metabolism. That has to do with their body. Well, cannabis, being a natural remedy, really has to tune into that body. And so people have different tolerance levels, CBD, THC, and the reaction to the terpenes. So finding your sweet spot is really, really important. And so I think one of the things I know your Turner's going to talk about tonight is, what is your tolerance to CBD? What is your tolerance to THC? You know, what terpenes best help your condition? And, you know, what dosing forms are you comfortable with? This is really a personalized type of journey. So there's ways of getting there very quickly to figure out what your sweet spot is. And so for those who say, I tried it and it didn't work, so I quit, don't quit. You know, you're on your journey. It's just a matter of just digesting what's out there. Turner, your comments on that? You've gone through a lot of patients that have tried to find their sweet spot.
Yeah, no, that's a lot of what we're going to talk about tonight. But you're exactly right. It's very individualized, and it's something that is different from, you know, your normal medication that you get at the pharmacy, and that you do have to sort of adjust it and play with the dose a little bit and find out what works best for you. So, but we'll give you some tips and pointers on how that what that really looks like in the real world tonight during the presentation.
Perfect. So let's talk about finding your dosing, your dose. I know that I'm going to steal a term that Trulieve came up with called your sweet spot. And I know, Sarah, you have a lot of documentation on that, which you'll bring up. But Turner, why don't you tell us a little bit about the endocannabinoid system and take it away from there?
Yeah, no, absolutely. Well, if it's all right, I'm going to kind of take over the screen share here, just to so I can kind of keep pace with myself.
I'll let you take it over.
All right.
Perfect.
So everybody see me there?
Got it.
All right, good deal. All right, so yeah, the endocannabinoid system. So to start off with understanding how cannabis works in the body, it's really important to understand that the body makes its own chemicals that are very similar to the chemicals that are present, or the molecules that are present in the cannabis plant. They're called, when they come from the body, they're called endocannabinoids. That means they are made within the body. And we actually have a system of the body that is tuned specifically to respond to these molecules. So this system of the body really works like a regulatory system. You can think of it as similar to the endocrine system, whereas insulin has many, many different effects in the body over a lot of different systems, or thyroid has many different effects over many different systems. The endocannabinoids are very similar in the fact that they modulate mood, sleep cycles, pain levels, inflammation. They have a lot of different actions in the body, and they're finding new actions new roles that these endocannabinoids play. Every week there's more and more work being done on endocannabinoid science since, especially, more and more states have made medical cannabis legal, and there's more access for scientists to study these things. But in the body, there are two molecules.
An important point about the endocannabinoid system is it really wasn't really discovered until 1940, and really wasn't studied until Raphael Mechoulam was studying cannabis in literally the 60s, 70s, and 80s. So it's not something that's new to medicine. The discovery of it is new to medicine, and that's why a lot of doctors don't know much about it.
Yeah, no, that's exactly right. I mean, I did not learn anything about the endocannabinoid system in pharmacy school, certainly. And most physicians, unless they have come out of school very recently, haven't learned much about it either. Even though there were, oddly enough, drugs have been on the market since the 80s that actually affects the endocannabinoid system. One called Myrcene that's been in use for a long time. That is specifically for chemotherapy, pain, and nausea, and those sorts of things. But that it's just it kind of goes to show you the strange attitude that we've had in the United States and really around the world with cannabis as a medicine, and the fact that we've had these cannabis analogs or synthetic cannabinoids on the market for a long time, but yet no one wanted to admit that marijuana has medicinal properties, even though they're imitating the same molecules, the same chemicals. So it really has been very strange that way. You have the pull of tradition and politics versus science, and that's really kind of where we're finally starting to overcome the tradition and politics side to get to the science and see that this really has a big effect on the body. And again, it goes back to the fact that our body is made to use these type of molecules. That's the reason they have such a profound effect. And so I kind of have a little slide here that just kind of breaks it down just to make it simple. The endocannabinoid system you can kind of look at as the engine when we're talking about the endocannabinoid system and the body effects. Naturally, the fuel that goes into that is what we make in our own bodies, the anandamide, the 2-AG, the endocannabinoids. If something goes wrong with that, then we have alternative fuel. That would be cannabinoids from the outside. So that would be your CBD and THC that mimic the same effect as anandamide and 2-AG. There's a lot of plants in nature that do this. We have many, many botanical medications or medications made from plants that mimic actions of our own body. You can think of, for an example, just it's not from a plant, but calcium supplement, for example, that occurs in nature, something our body and bones use to get strong and stay strong. We supplement with calcium if we're calcium deficient. Just one example of nature imitating what our bodies do. And then, like Marc mentioned, one smaller piece but an important piece of medical cannabis are these terpenes that sort of direct the way the cannabis can act in the body, and we can tailor it to specific conditions a little better with these terpenes. When we talk about
Turner, if I can, when you talk about alternative fuel, I'll use myself as an example. I'm a senior citizen, and my body doesn't produce the amount of endocannabinoids that it did when I was younger. And so, why would I need alternate fuels? Because in my case, where I have pain in my back and my neck from an auto injury, it doesn't hurt to have my body have, in essence, the fuel, the batteries, there to be able to help it. And I know that there's certain conditions like migraines where it's been shown that one of the conditions that brings migraines on is a lack of endocannabinoids. The body's not producing enough of them. So really what it's doing is helping the body, which, by the way, produces its own quote unquote cannabis, which is what the anandamides are doing. All you're doing is complementing that. You're not conflicting with it.
Yeah, exactly. You're supplementing. It's a supplement. You can really look at cannabis as a natural supplement, just like melatonin or other neurotransmitters that we try to supplement naturally. St. John's wort, those sorts of things that help regulate mood. in sleep. It's just right along those lines in affecting the system of the body. This is just, go ahead.
I couldn't agree with you more, Turner. I speak with patients and physicians all the time about the importance of looking at it, as a supplement, as something that can increase your quality of life day over day. And I think it's so important to really focus on the dosing piece, because if you can get this right, it really can have a positive impact on so many aspects of your life. So really love that you focus on the supplement aspect of it.
Yeah, absolutely. Well, like Marc mentioned, a lot of these, we're treating chronic conditions for the most part with medical cannabis. That really means we need to keep the cannabinoids and use medical cannabis on a daily basis to keep those cannabinoids in our system so they're there when the body needs them. If we're preventing migraines because your endocannabinoid level is low, then you need to have that supplemental cannabinoid in your body so it's there to use, or sleep is the same way, or fibromyalgia is another condition that really has been shown to have the endocannabinoid system plays a big role in. So yeah, exactly. It's a daily supplement, and that's why it's important to find the right dose so you can function well, minimize those side effects, and function well on a day-to-day basis, and improve your quality of life there. So this is just another slide quickly to sort of dig down a little deeper in that endocannabinoid system. You have two different receptors in your body, CB1, CB2. CB1 receptors, that stands for cannabinoid 1, cannabinoid 2 receptors. They're finding new cannabinoid receptors, fairly often. But CB1 receptors primarily in the nervous system, CB2 receptors primarily in the peripheral organs and the immune system. CB2 plays a big role. All these cannabinoids work together to affect this system. So when we talk about engaging the endocannabinoid system, we want to mimic as best as we can the way our body uses these cannabinoids. So we don't want to take just one piece or another and stimulate just that one receptor. Traditionally, in traditional pharmacy or traditional pharmaceuticals, they are very targeted. They try to make these chemicals so they only affect one receptor or even one area of a receptor. But really, this is more of a holistic approach in the fact that we want to engage the entire endocannabinoid system because our body uses that to stay in balance, to to maintain its normal function. So the more we can stimulate the entire system, the better we can do, the better result we get. When we start isolating these things, for example, I mentioned that drug Myrcene that's been on the market. It only imitates THC. There is no other cannabinoid that it imitates. So it only stimulates these CB1 receptors. And a lot of people can't use it because they don't feel good when they take it. If you overstimulate the CB1 receptor without engaging the CB2 and the other parts of the cannabinoid system, you can get nausea, you can get dizzy, you just don't feel good. And that's why it's important when we talk about what we call the Entourage Effect, using all these cannabinoids, and there's over 100 of them in the cannabis plant, together to really maximize the stimulation of the endocannabinoid system. Again, we use this lock and key image a lot. This is one of the first things we see in pharmacy school when we walk in, because again, when these we look at the receptors as the lock, the molecules as the key, and we're stimulating these by selecting the right shape molecule to fit in those receptors or locks. This is the kind of thing we just went through. CB1 receptors again in the nervous system, which when you think about it, if THC stimulates CB1 receptors, and we know that THC is the part of the cannabis plant that can cause intoxication or the high that we treat as a side effect, makes sense that it stimulates the CB1 receptors. CBD that we've heard a lot about, it doesn't actually, the weird thing about CBD is it doesn't actually stimulate directly the CB1 or CB2 receptor. It just makes the other endocannabinoids work a little better in the fact that, the body uses it to sort of prime or amp up the endocannabinoid system a little bit rather than direct effect. And CBN is a endocannabinoid that has recently, a lot of products have started to use this for sleep. Really is excellent to help sleep and inflammation. So you see that in some products as well. But like I said, there's a lot of different cannabinoids. That's a big rabbit hole we could spend a lot of time in. But the key I want you to take away from this part is it's important to use these cannabinoids together. Using one or the other, using just CBD is not going to give you the same effect as using CBD and THC together. same as using very high levels of THC with no other cannabinoids can also cause a lot of side effects. So that's just something to keep in mind there as we move forward. This is just a slide of the cannabis plant. I don't want to spend too much time on the molecule side over here. I don't think anybody wants to take an organic chemistry class tonight, and I would certainly be very bad at it at this point, so we'll just skip that. But the cannabis plant here, I just wanted to kind of show you just an interesting thing. The cannabinoids that we're talking about are actually come from an oil extracted from the plant, and they're inside these little oily bubbles on the plant called trichomes. This is where it's really what everybody's after when we're growing cannabis plants and what they extract these oils and medications from. So we have this big plant that we all see, and we all basically boils down to these little trichomes that we're all after to get the oil out of the plant. So just a little bit of interesting trivia there. We just talked about THC and CBD. Again, we hear a lot that THC is the recreational drug, side of cannabis and CBD is the medical side. That's really not accurate representation of that, because THC does have a lot of positive medical effects itself. THC can help sleep, it can help pain sensation, it can help nausea, it can help boost mood, those sorts of things. And in CBD, as we know, as we have everybody's heard over the past few years, has a lot of anti-inflammatory, anti-anxiety effects, help sleep, muscle spasms, those sorts of things. But again, the key is really to use these together. One very interesting aspect of this is that CBD actually reduces the psychoactivity of THC. So when used together, you can use a lower THC dose to get the same positive effect from THC without as much intoxication. So that's an important aspect of that as well.
And that's a really good point. Go back to that for a second, because a lot of people worry about, I take a cannabis product, I start getting high. How do I fight that high? And the answer is, if you have some just CBD, some full spectrum or broad spectrum CBD there, and you just take some, it'll bring you down off of that high. And that's really important as you're working through this.
Yeah, no, absolutely. I mean, again, that goes back to that, the importance of that entourage effect and using these cannabinoids together. We use this a lot just to demonstrate to patients, again, the importance of this entourage effect, using the different cannabinoids together. When we talk about, for example, a pain medication, when we talk about opiates that we've all tried to avoid and have heard, and know these horrible things about over the past 20 years and their addictive properties, what opiates do is they relieve the sensation of pain. They do this one little thing right here. So they don't help inflammation. They don't help any other aspect of pain. All they do is they block pain signals from the body to the brain. So when we talk about using medical cannabis as a pain medication, we can see that not only does it relieve pain, but it also helps inflammation. It also helps anxiety. It also helps boost mood. All of these things, it's a much more holistic approach to treating pain because it does more than one thing in the body, and on top of not being nearly as addictive as opiates. So that's when you hear this debate about opiates versus medical cannabis for pain. That's really the key difference in my mind. There are two key differences. One is the safety and non-addictiveness of cannabis, but number two is just the multiple positive effects that it has in the body versus the single effect of opiates that definitely declines over time. So it's just a much better starting point, much better solution. Opiates have their place, of course, for severe pain and acute intractable pain and those sorts of things, but for chronic pain, for daily, back pain, inflammatory conditions, medical cannabis can just play a very important part there because of, again, this entourage effect.
You brought up something that's very, very important, and that is that when you're using the THC, the key is to find out your ratio of THC to CBD that works for your particular body, and that's where the magic is, because every person's body is a little bit different. But what's really important is, if you can reduce the inflammation, in many cases, you can reduce the pain. And so by starting a regime that has CBD and THC in it, at some point in time, you'll be able to actually reduce the amount of THC and increase the amount of CBD to get better pain relief. And that's important. The other part I think I want to point out is it doesn't have the negative side effects that you have with pharma drugs. like Percocet. I know that when I had my knee operation, you know, they gave me some Percocet, and it has a lot of negative side effects with your plumbing and a few other things. You don't have any of those problems with medical cannabis. This is something that is natural for your body, and it just helps you be able to really feel better, not just with your pain and your inflammation, but your overall mood as well.
Yeah, no, absolutely. You know, just moving on, we talked about terpenes briefly. These are just some of the terpenes that are present in the cannabis plant. Terpenes are volatile chemicals that are present in most plants. They give plants their unique smell or unique taste. There's a lot of them out there. If you're familiar with aromatherapy at all, or essential oils, they work on the concept of terpene treatment. And these terpenes, they found that some of them have medicinal effects within the human body. One that plays a very important role in cannabis is this one called myrcene or beta myrcene. It is responsible for the relaxing effect of not only cannabis but also lavender. So if you're familiar with using lavender oil, you know, that is something that you know, is used for sleep and rest and those sorts of things, and really differentiates the, you know, when we talk about strains, we hear a lot about, you know, one indica versus sativa strain, and the difference between those two strains is the amount of beta myrcene in the strain. That is the difference between the two, in the fact that you know, the more relaxing strains have more beta myrcene, the more stimulating strains have less. Just kind of, and that terpene profile is something when you're choosing a medical cannabis product in the dispensary is important to treat what you're trying to treat. You know, obviously, if you're using something during the day that you're trying to, you know, regulate pain a little more, regulate mood during the day, you want to use something with a little less of the beta myrcene that's going to cause sedation. If you're trying to use something for sleep, you want to use a little more, or a strain with higher beta myrcene, or a product with higher beta myrcene. Most of the dispensaries now have gone away from the strain system, the indica sativa strain. You know, most of them, when you see, you know, for example, a hybrid strain, that usually means, you know, they've mixed two strains together, or they have a strain that is equal parts sativa, indica. All that is really just changing this terpene profile. So really, you can, you know, just this is the most important thing. It's something to talk to. You know, the dispensaries can usually help you navigate this, but also just something to keep in mind when you're selecting your product, that not only is the THC, the CBD important, but also this the terpene profile will be important to maximize the benefit that you're looking for in these.
And that's an excellent point, That's an excellent point, Turner, because when I first got involved in cannabis, and I went to the dispensary the first time, there was a recommendation by my doctor, and the dispensary personnel said, here's the product that I think you should try. And of course, if you look at the dispensary, it had lots of products on the wall. No, so my question the second time I went back was, out of the hundreds of products that are here, how do you know which one is mine? Works for me. And it had to do with the problem I'm trying to address, and it had to do with the terpene profiles, and it had to do with the you know, and it had to do with the amount of CBD and THC, the ratio that was there. And actually, as you'll get into, I experimented with starting with a 1-to-1 and moving up from there to find the right product. But the terpene profiles are really, really important. Like, for example, pinene is really great to help with memory. Pinene is not good for somebody who has PTS, because that's something that's going to help, it's going to bring on that particular situation. So I think this is where your dispensary personnel can help you figure out the products and the terpene profile. Is that right, Sarah?
Without a doubt, all of our dispensary associates are well-trained consultants, and they can answer any of the questions that you might have about terpenes or the different strain contents that we have currently. But I can't emphasize enough how important it is to remember how individualized, you know, your cannabis regimen is. And one thing that I also encourage a lot of patients to do is to keep a journal. You know, keep track of the different strains that you're using, their terpene profiles, so that you can really start to pinpoint what works for you and what doesn't. And then from there, whenever you find a product with Trulieve that might not work in the way that you want, you know, because we all interact with cannabis differently, you can also return at any time. We have a no questions asked return policy, and we have that in place so that you can really start to play with your regimens and find something that works best for you. So those would be my 2 recommendations and tidbits there.
No, I think that's important. And this is where the dispensaries come into play, because you have a particular situation that you're trying to, a medical, lifestyle medical condition that you're trying to address, and they can help you guide which product they have that can be able to help you. And by the way, this isn't like you go into a Walgreens and you go to a CVS pharmacy and you buy the same product. They are fundamentally, the dispensaries here in Florida are required to grow the product, manufacture the product, and then sell the product. Yeah. So although there's a one-to-one product, they are a little bit different. What's the difference? A lot of it has to do with the terpene profiles. So this is where your dispensary can help you with your particular type of product that can help you on your journey and help you really home in on that sweet spot.
Definitely. And it's important to know, the type of relief that you're looking for. Is your goal to get better sleep? Is your goal to increase your appetite? Is your goal to reduce anxiety throughout the day? So it's important to know exactly what your goal is and communicate that to your consultant so you can collaborate on the different products that might work best for you. Sure. Open discussion.
And Turner, you have a really good slide here, which I think it's important to go through. There's this perception that the bigger you are, the more tolerant you are to cannabis, and that's nothing further from the truth, right?
Yeah, no, these next couple of slides here are going to get into the actual dosing aspect of it here, and that's a huge advantage that Sarah mentioned of being able to return those products because it does when a new cannabis patient will typically have to adjust their dosing and product 3 to 4 times to find the right balance of what they're looking for. So having that is a big advantage, and the journaling is a great idea. Because that is something that it gets very confusing. There's a lot of different variations. There's a lot of different combinations. So keeping track of what you used, what has worked, what hasn't worked, is really important as you work through this. The problem with cannabis, or you say problem, but really the challenge with cannabis is that there's just the individual variation, like we've mentioned a few times. So when you're talking about a system of the body that affects the entire body, like the endocannabinoid system does, there's a huge variation from one person to the next in the way their body, handles that system or that system behaves in their body. Whether it's the number of receptors, which can be genetic, whether it's the metabolism of the product, whether it's the clearance rate of the product, how fast your kidneys and liver clears out a product. All of those things vary from person to person, and so that's why it can really be a challenge to find the right dose for a patient. We have some patients that we've treated that 10 milligrams of total cannabinoids, that's a combination of CBD and THC, will be fine for them, or almost too much even. And while some others, can be up to, when we look at some of the children that we've seen that suffer from epilepsy, some of those doses can be over 1,000, 1,500 milligrams a day of cannabinoids. So really, the good thing about cannabis is that it's so non-toxic that there is no really upper dosage range. But the negative side of that is some patients really need a lot to get their dose. Now the normal range, those are one extreme to the other. The normal range for patients is usually somewhere between 30 to 50 milligrams of cannabinoids a day. Which is, again, that's some combination, a total of THC and CBD. So whether it's 10 of THC, 20 of CBD, for 30 milligrams, those sorts of dosing. So, but that is in medicine, in treating patients, it's very rare to have any treatment that has that sort of dosing range ability to work with. So it's a benefit and a challenge.
That no one's ever died from using cannabis, both recreationally or
no, exactly. We'll talk about that a little in a few slides here. But yeah, that's exactly right. That we call that therapeutic index, or the dose that the minimum dose to the maximum dose that would be dangerous. Is just extreme with cannabis. It just that upper range is really remarkable. So dosing concepts that really the concept that we want to with any medication. From a medical standpoint is, start low, go slow. You want to use the minimum dose that you can to get the effect that you're looking for. And this is important with cannabis, especially, for those patients looking for, looking to function well throughout the day, looking to minimize that intoxication, because, we really look at the high or the intoxication from cannabis as a side effect. It's just like if you take Xanax, for example, if you take, your doses is one Xanax at bedtime. Well, if you take 3 or 4, then you're obviously going to have a much more profound effect, and you didn't really need it. The same way, with cannabis, for a lot of patients, you want to find that minimum dose that treats your symptoms while preventing that intoxicating effect, to again improve your quality of life. That concept is out there. It's called microdosing. Again, that is administering very small amounts of the drug to benefit while reducing the side effects, and that's really the whole goal with medical cannabis treatment. Just a visual response. Most drugs have a you increase the dose, the effect goes up, and then it plateaus, and that's really called a monophasic dose response relationship. The higher the dose, the more the response, and the more side effects that you have. But cannabis doesn't really follow that. It's more of a the higher the dose for some patients, it actually once you move past that therapeutic dose, you can actually start having more side effects than benefit, and that's really what you want to avoid with that. Ultra high doses, that not only they're expensive, that's another consideration with medical cannabis is the cost. So you definitely want to minimize the use of the medication as much as you can from that aspect. But most patients do better at lower doses, actually, in treating their symptoms. This is sort of, again, a visualization of that, starting off at low doses, and then once you reach a particular level, all of a sudden you start your benefits start to decline and your side effects start to increase, and that's what we want to avoid. Studies have actually, again, I mentioned a lot of studies that have started to be done with this. There are studies out there that actually demonstrate this. But in this particular study, they looked at 263 cancer patients, and they gave them different dosage of combinations of THC and CBD. And the interesting thing with this is that the group receiving 21 milligrams of THC and CBD a day experienced significant improvements, even more so than the 52 milligrams per day. And the 83 milligrams per day actually, it went the opposite direction. They actually reduced their pain no better than placebo. So, by overstimulating that endocannabinoid system, overstimulating the CB1 receptors, you can actually increase your sensitivity to pain. Well, again, another important reason to keep that THC and overall cannabinoid use down to the minimum effective dose that you can to avoid those side effects at higher doses. The reason this is possible too is something called tolerance that builds up in the body from using medications over a long period of time. And this is especially true in the endocannabinoid system. It's very sensitive, the endocannabinoid system is, and when you overstimulate it, some of those CB1 and CB2 receptors actually are pulled back inside the cell. So this is actually a stain slide of cells, and these arrows are pointing to the CB1 receptors, and by increasing the dose, you can actually see that there are fewer and fewer as time goes along of these THC receptors, which makes you have to increase the dose to get the same effect, thereby increasing the side effects and reducing the benefits. So, again, over time, the lower that we can keep the dose, the longer we can stretch out this tolerance effect. The positive thing about medical cannabis is that, unlike some medications, taking a drug holiday, for example, taking a week or 2 weeks or 3 weeks off of taking medical cannabis, the body bounces back really quickly, and we can reestablish the effectiveness of that dose, whereas opposed to something like opiates, where we build up tolerance, over years, and there's really nothing we can do to bring that tolerance back down, short of, stopping the opiates completely.
That's a good point.
Something again.
That's a good point, because I have to deal with severe pain. I have 7 herniated discs in my neck and 2 in my back, and my pain level can be very high. And there's no surgical or medical process to help me other than candidly medical cannabis. But every 6 to 8 weeks, I'll take a day off. I try to take 2 days off, and what happens is it helps to reset my body. And I'm not addicted to cannabis. What I'm addicted to is getting rid of the pain. And the reason I say that is because after 24 hours, and sometimes even after getting close to 48 hours, my neck taps my shoulder and says, "Cowboy, you better do something. You better give me some help, because the pain is coming." So really, I can feel where the pain it's coming back, and it comes back because I have more swelling. And when I get swelling, I get pain. And my perception was to just put a bunch of THC, throw THC at it, to solve the problem. But in reality, I really needed to use much more CBD. So that holiday is very, very important because I use less product and it helps me be more effective with the products that I do use.
You know, that's a good point. And there's a big, you know, that you mentioned there's a big difference between addiction and tolerance. Tolerance just means that, you know, your body's used to the medication. You're not craving it. Your body's not functioning, you know, or not functioning well because you're not getting it. That's addiction. You know, this is just your body's used to using it and it needs a little more to get the same effect. And we can minimize that again by holidays and minimizing doses.
Really helpful, yeah.
Sarah, do you have something? Sarah, do you have something you want to add there?
I was just going to say, it just speaks to just how naturally occurring endocannabinoids in our system, that you can reset that entire system that quickly with just a quick break like that. You know, you mentioned the opioid, it's a pandemic where I'm from, and it takes years to get some people, you know, off of those high doses. So it just speaks to how quickly you can reset this system and just how holistic medical cannabis really can be. So.
Exactly. So again, you know, we talked too about the importance of this entourage effect, combining these cannabinoids rather in your medication doses. This is just a study that sort of represented that. They looked again at 177 patients with cancer pain. They looked at one group received just THC, another received an oral spray of THC and CBD combined, you know, as well as a control group, of course. They both increased their dose until they got relief, again, adjusted their dose until they felt a good effect. And so what they found from that was that the THC group ended up using an average of 27 milligrams a day, while the CBD plus THC used closer to 60 milligrams total a day. But the CBD and THC group had a superior reduction in pain. So, you know, even though, you know, when we talked about 60 milligrams total, that's 30 CBD, 30 THC, but they had a better response with pain because, again, we're using CBD along with it. We're reducing inflammation. We're reducing the way the body feels pain with that combination as opposed to the THC at the same level by itself. So that's just, you know, one example of how the entourage effect can maximize the effectiveness of the medication. You know, so dosing suggestions, how much should I take, formulation, strains, you know, we talked about that, you know, finding out how much you should take. Again, most doctors, if you're new to cannabis, even if you're not new to cannabis, have protocols that they will start their patients at, you know, whether dependent on whether they've used cannabis before or not. You know, if you're native or cannabis naive, as we call patients that have not used cannabis before, usually we'll start you off at, you know, somewhere between 10 and 20 milligrams total a day of cannabinoids. For more experienced patients, you know, it may be 40 to 50 milligrams a day. Again, that has to go back to that tolerance and how used our bodies are to using cannabis as a medication. But then adjust from there, you know, adjust upwards until we find the type of relief that we're looking for while minimizing the side effect. The goal, again, for patients really looking to use this as a supplement on a daily basis is to balance the symptom relief and impairment there, the effects of that between the CBD, THC, and the other cannabinoids there.
Yeah, and it's important. It's important as you're getting into it to understand what is your tolerance level to THC. You know, how much. At what point do you begin to really feel the euphoric effect of THC? You know, and then back down a little bit from there. Because THC is very helpful, for example, for pain, but you don't want to run around high all day.
Exactly. Well, and this is this phrase down here, this ECS tone, sort of speaks to that. That means, you know, what stage your endocannabinoid system is, how sensitive is it to cannabinoids, and that's something, again, that's individualized, variable. Depends on a lot of factors, but something we have to take into account. Other factors you have to consider: method of administration. You know, what's the best route for you, which we'll talk about in the next couple of slides. Safety, tolerability, how well is it working? Potency is something. So there's really three things you have to look at with the medical cannabis product. You have to look at the terpene profile. You have to look at the ratio of CBD to THC. Typically are the main ratios that you look at. But you also have to look at the potency of the product that you're using. You know, the concentration can be different, and what that means is how many milligrams per per unit are you looking at? So if it's a liquid, how many milligrams per ml? If it's a powder, how many milligrams per gram? Those sorts of things of cannabinoids are in there. So you may have a bottle of tincture, for example, that's a 1-to-1 product, but one bottle could be a 1-to-1 with 25 milligrams in the bottle, and the other could be a 1-to-1 with 100 milligrams in the bottle, and that means a half a dropper full is going to be a big difference between the total, the 25 milligram and the 100 milligram. All those things taken to consideration that are important.
By the way, what you're talking about here when you're talking about milligrams in the bottle, it's just like proof in alcohol. What's the proof of that alcohol? How strong is it? That's what you're really talking about.
Exactly.
Yeah.
Exactly. So standard dosage forms that we see use sublingual drops, tinctures, inhalation, certainly the vaporizer pens are certainly one of the most popular. Capsules, when we talk about oral dosage forms, capsules, edibles, or as well as the tinctures would be considered oral dosage forms. Edibles, new on the market, so those are lozenges, gummy medications, chocolates, those sorts of things. And then, of course, you have the natural plant product, the non-extracted products, such as flour, that's available as well. Sarah, did you want to jump in here and just sort of kind of talk through some of these?
Definitely. So with Trulieve, one thing that you're going to notice is we have a very wide menu now. So for all of our new patients, you're going to be able to really play around with your routes of administration and figure out which route works best for you. For some patients, the capsules are ideal. It's part of your regular daily regimen already with your vitamins and things like that. For some patients, it might just be a traditional vape pen. It really depends, and it's so individualized, as we've been saying. But I can assure you that with Trulieve, if you come to us and work with our associates and our consultants, we'll be able to talk you through each route of administration, highlight the products that we have in each, and really help you find that regimen that works best for you.
Yeah, so when you're selecting a route of administration, again, the effect that what we're treating is really important, because the biggest difference between these routes of administration are how long does it take to work, how long does it last, and how, as well as how easy is it to dose. So those are really the big considerations. So, you can see here from this slide how variable some of these dosage forms are. So most of the oral dosage forms, you have a duration of effect, which is how long the effect lasts, usually 4 to 6 hours. An inhalation would be somewhere between 2 to 6 hours, but it works almost immediately, as opposed to an oral dosage form, which can take up to 20 minutes to an hour to really work. Topicals are typically much more localized effects. So for topicals, you can think of an inflamed joint or some neuropathic pain somewhere that's bothering you locally. Typically the most effective. Transdermal patches would be considered a topical, but they do get into the bloodstream and give you a blood level, a steady state blood level of cannabinoids. So for patients who have chronic pain throughout the day and don't need a big level of cannabinoid to work, the transdermal patches may be a good option, but it typically won't get your blood levels up enough, as opposed to a tincture or edible, that if you need a higher dose, that it would be really effective for you. But a lot of people do use transdermal patches for minor conditions. But the edibles and capsules have certainly become more popular. And one really thing to consider here, it is much easier to dose while you're figuring out what your dose is. It's much easier to dose a sublingual drop or tincture or an inhalation version than it is an edible, because with edibles and capsules, you could half them with edibles usually. With capsules, you're kind of stuck with what you have. So with the sublingual drops and tinctures, as you're figuring out your dose, you can take a quarter dropper full, a half a dropper full dropper full, to kind of see where your sweet spot, like we mentioned, is for those dosing as you're wrapping up. And then once you kind of figure that out, then maybe looking at an edible or a capsule, especially during the day. It's not as important at night necessarily, where you can sleep. If you're looking to help you relax and sleep, then having a little higher amount than you may want is not such a problem. But if you're trying to function throughout the day, you really want to be careful and find the dose that works for you without getting that intoxication, so you don't have any problem functioning throughout the day. So sublingual drop or tincture is
important thing you talk about mixing and matching. Like I have a high level of pain in my neck, in my back from again the auto accident, And so what I do in the morning is I take a tincture. When I wake up on my bedstand, I have a tincture drops, and I take the tincture drops. And typically they'll take 20 to 25 minutes to work. But if I have a high level of pain, I don't want to go through even 20 minutes of that. So I have a vape pen right next to it, and I take 1 or 2 hits off the vape pen, and literally within a minute or two, the pain goes away. And I mean, it goes away. The first time that happened, I said to my wife, this is crazy. It's like somebody took my back and wiped it clean of, and there was a lot of pain. And, the level of 7 of pain is a lot. Went down to a 1. And even when it happens, like when it happened this morning, I still am always amazed at this. But you can mix and match these. I use inhalation in the morning to get started. It lasts about 2 hours. Then the tincture drops kick in. They'll last anywhere from 4 to 6 hours. And that'll take me into the early afternoon. So my regime is early afternoon. I have another regime I use to be able to do that. Again, I take a tincture drop primarily. And I use the inhalation during the day only if there's a spike in the pain or something like that. And if I kick a curb or do something crazy. I do believe, and I really love transdermal patches, because you mentioned microdosing earlier, Turner. Transdermal patches help a lot with that. They help that constant CBD getting into your body really can help quite a bit with that. So you can mix and match these dosing methods to what's comfortable for you. Let's put it that way.
I really appreciate you sharing your own care routine there, Marc, because I work with a lot of physicians on helping their patients find, things for immediate relief. If you feel that immediate spike of pain or that immediate hit of anxiety, have something on you that you can use in that moment, but then also have your long-term relief products as well. And then from a cost effectiveness standpoint, it does save you a little bit of money. If you're hitting your vape pen throughout the day, you are going through that product very quickly, and the relief doesn't last as long as, say, a capsule does, or an edible, or a sublingual tincture. So you're kind of spreading out, maximizing your overall investment in every aspect of it. So thank you for sharing that.
And Marilyn asked a really good question. She said, if I have a significant amount of pain on a daily basis, how can I take a day or 2 off? And I'm going to answer that pretty straightforward. A lot of the pain that I have, like the herniated discs in my neck and in my back, really come from being inflamed. And it's that inflammation that brings the pain. Now, again, this has been over 4.5 years, but as I take cannabis, it reduces that inflammation. And it gets it down to a point where it becomes more tolerable. Actually, we need less cannabis to be able to get the effect that I want. But what's interesting is if I take a holiday for a day or two, because I've brought down my inflammation level from the initial injury, I brought it down to a point where it really is, I can take about a day. About a day is my tolerance level. And then my neck will tap my shoulder and say, hey, it's coming. Sometimes I try to take a day and a half only because I'm really trying to, let's just say, really adjust. But it just has to do with the fact that because it is holistic, it's something that's in your body, it builds up in your body. I'm really cashing in on the medical benefits of cannabis from a day or two before when I take that holiday. Okay, so it's not like it's not like a pharma drug where I go cold turkey and all of a sudden there's nothing there. There is something that's there. It's just what I'm doing is I'm letting it run out. I'm letting the tank empty so that I can then go back and refill it to the right level again. Is that a fair assessment, Turner?
Yeah, no, that's typical of what we see with the holidays on that. Everybody's situation is different, certainly. On that, some patients it's easier to do than others. But yeah, typically, even if you can supplement for a day or two with a pharmaceutical, just to let the cannabis clear out to reset those receptors, it may be something to consider as well. So,
but you are right. When I get to that second day, I can feel it. Okay, so that's again.
Yeah,
I'm not addicted to cannabis. What I'm addicted to is getting rid of my pain. And it is the best way to get rid of the pain without having negative side effects on my body.
That's right. So this goes to the dosage forms, and this is something that I always find interesting, and it always kind of helps me think about why is there such a difference between the way an inhaled product acts in the body versus an edible product. And it has to do with the way they're metabolized in the body. So when you inhale with the vaporizer cannabis product, it goes directly from your lungs into the bloodstream. It doesn't pass through any of the digestive system or anything like that. So that delta-9 THC, that THC that's in the cannabis that you're inhaling, goes directly into the bloodstream. You can see the spike here, this red line, that spikes very quickly and then it drops off. So we talk about that duration of effect and you know, how quickly that works. These are minutes here, 1 minute, 5 minutes, 10 minutes. You kind of max out and then it drops down. With an edible, it's different. It goes to the stomach, and the primary form of THC that we get is this 11-hydroxy-THC, which is a metabolite that comes from the delta-9. It's metabolized into this 11-hydroxy, which is actually much, much more potent than delta-9 THC is, and it lasts much longer. So, you know, when we're thinking about, okay, I need a product to help me sleep, well, what we want is something that's going to last all night, and these edibles are really good at that. You can see how long, you know, it peaks at about about 3 hours. So that's, you know, and lasts throughout the night, 6 hours. You still have some, you know, even in the, you know, detectable after 24 hours, but it's much, you know, the real effect is in the right where you want it when you're trying to sleep, and it lasts all night, as opposed to the inhaled products. If you're trying to use them to sleep, you may get to sleep. They work really quickly, they last, but then you may not stay asleep because, you know, as we see, they wear off here pretty quickly. So those sorts of things are considerations and why there is such a difference between edibles and inhaled products that way. Inhaled products, you know, or edible products, I mean, you know, such as edibles, such as capsules, anything you swallow that goes into your stomach is going to have the same effect on these. So you can see, you know, when adjusted, you get a much larger effect from this 11-hydroxy than you do from inhaling it, which obviously the 11-hydroxy being more potent, being lasting longer. You know, this is why you see stories in the newspaper sometimes about people using edibles and ending up in the emergency room, not that they're in danger, but that they feel terrible because they've gotten a huge dose of this 11-hydroxy, which takes long to get out of the body. So that is a reason to be careful with edibles. You know, we've all heard stories of people thinking, oh, I took one edible, it didn't work, so I used another one in 20 minutes. Well, that's, you know, you don't want to do that. That's a bad plan. But this is the reason for that is this metabolic profile that behaves in the body. We talked a little bit about safety of cannabis earlier, and you know, this is the reason why cannabis is as safe as it is. So, 2016, the World Health Organization put out a big paper looking back through all of the data that they had and found that nowhere in their literature could they find a report of a fatal overdose. And the reason for that is, you know, there's actually this chart here shows a ratio of fatal dose to effective dose for several different types of chemicals and drugs. You know, some we can see here that are much more toxic than others. What this means, you know, if we look down here at heroin, which would be the most toxic on this list, has a ratio of 5, which means, well, let's go here to alcohol. It's a little more relatable. We go to has a ratio of 10. So what that means is 1 shot of tequila were enough to get you drunk, which would be the effective dose. Then 10 shots may be enough to be fatal for you. And we look up here at cannabis, there's a ratio of over 1,000, which means, you know, it's just an extremely high ratio. You know, the DEA actually did a study a while back and found that you would have to smoke over 1,500 marijuana cigarettes in an hour to be fatal. So you can see it's almost impossible when we're talking about you know, overdosing on cannabis to, you know, with a fatal result, to get that much cannabis in your system fast enough to be fatal. The reason for that is that these cannabinoids have very little effect on the area of the brain called the brainstem. For whatever reason, the way our body's developed, that endocannabinoid system just doesn't have a big effect on the brainstem in the body. So, you know, that's really the area of the brain that is affected when patients overdose on alcohol or opiates or benzodiazepines, or usually a combination of the three, is they suppress the activity of that brainstem, which is responsible for your heart rate, for your breathing. You know, typically when someone overdoses, they suffocate because the brainstem activity is suppressed, and cannabis just doesn't have an effect on that area of the brain. So when we talk about that toxicity level, that's why it's so non-toxic. It doesn't affect the vital systems of our body the same way that some other abused medications do. So when we talk about one thing our physicians really want to see our patients do is use the CBD and THC together. We have some patients out there from a cost standpoint, they really only want to buy the THC at the dispensaries. You have to have the medical marijuana card to buy products with THC in it. You can buy CBD products without a medical marijuana card, but we really advise our patients to be careful with that. When you're buying over-the-counter CBD product in a gas station or these sorts of things, the quality, the issue with product quality in Florida is really pretty dramatic from the regulated dispensaries that have to grow the product, harvest it, manufacture the medications, all these things. They're tracked for quality and quality assurance every step of the way. A lot of these CBD products that are on the shelf are unfortunately not regulated. The FDA has taken sort of a hands-off approach to CBD products, and they operate in sort of this gray area where no one really looks at them. So you can actually go on the FDA website where they tested some of these CBD products and found much lower amounts of CBD in the product than is advertised on the label because no one's checking behind them. You can think if there's a financial incentive not to put as much CBD in a product, and you're not going to get in trouble for it. Unfortunately, most bad actors out there will take advantage of that, and that's kind of what's going on. Florida's recently passed some rules to sort of try to rein that in some, but those rules are very recent, and it's still sort of you have to be very careful when you're buying CBD outside of a Florida licensed dispensary that you're getting what you're looking for there. If you do buy a CBD product, outside of the dispensary setting, then we do, our physicians do recommend full spectrum CBD products, which means they have a combination, a low level of very low, less than 0.3% level of THC and other cannabinoids in there, so they have a little more of effect. We do carry some in the MMTC dispensaries, and the reason we do that is, again, for cost reasons for our patients. We want to make sure our patients take advantage of CBD. And from a cost perspective, some patients will go in and say, well, it's just not worth me spending the money in the dispensary on a CBD product when I can use that same money and buy more THC. So we want to make sure that there's a good quality CBD product available for patients, at a cost that may be more cost effective for them. So we have our own lines that our doctors have vetted, looked at the lab results and all those sorts of things that we can be careful about. But it is, the reason that our doctors, we offer that in our doctor's offices is just to make sure to give our patients every opportunity to take advantage of that entourage effect, because it's so important that they do get the CBD with the THC, and we don't want them to be scared off from a price perspective or trying to compare apples to oranges with CBD and THC pricing and those sorts of things.
See, that's a good point, Turner. I mean, one of the things that you did, I thought you did very effectively, was there's the noise level around CBD. How do you find a good quality product, and how do you find it at the right price? You kind of broke through that. You all did, all your doctors, and you did some studies as to what the right products are. You put them into a website, My Botanical Wellness, which, by the way, anybody can purchase from that website. And if you do use the coupon MMAW10, you get a 10% discount on that. And we'll follow up this webinar by giving you that coupon code. But the point I'm making is, go back one slide there, Turner. Go back to that slide on My Botanical Wellness, if you don't mind. These are physician-recommended hemp products. These are different from Trulieve. Trulieve has marijuana-based products, and so the question becomes, where do I get my cannabis product, my CBD product, and how do I know I have a high-quality product, and how do I have one that has that's been tested that really works, and not only just for myself but also for my pets, because I may use it for sleep, I may use it to help to cut off the euphoric effect. So this is why you put this together, and I think again you can go to that website and purchase it, and I think that's very effective. And I'll also point out for pets it's really important, because vetting that, you just don't get into your pets. Man, they'll do that. There are products designed for that.
By far and away, the biggest product that Botanica sells are pet products, because THC for pets is actually somewhat toxic for them. So it is better to get the CBD products rather than share your cannabis products with the pets. Not that anyone would do that, but I know that does something that goes on in the world, but just something to be aware of, that the pets don't usually always respond very well to THC. So
what that site is doing is it's complementing Trulieve. And really, we're working hand in hand to be able to provide those products so that we can, people, as you mentioned, get the right put their money into the THC products that they need, but they also have the CBD products to help regulate that and also be able to
right, exactly. Well, we want everybody to maximize their dollar, and being able to buy as much of the THC at a cost-effective rate as you can is important. But we also want you to have that CBD option available. That at a price point that it may be a little different. So
certainly. And I was just gonna say, for us, regardless of whether you get your product from Trulieve or through MMTC, the quality is really what you're looking for, what you should really be focusing on. We do all of our own in-house quality assurance, but we also do third-party lab testing as well, so you can have that peace of mind that all Trulieve products go through extensive quality assurance checks, and the product that you're getting is in fact what it is labeled as. So thanks for expanding on that, Turner.
Yeah, no, absolutely. Yeah, I've seen that quality assurance firsthand with the Florida dispensaries there. It's quite something. Yeah. So yeah, no, you can rest assured if it comes from a Florida licensed dispensary, it's been well checked for sure. So so the potential adverse effects for medical cannabis, again, very minimal. I heard somebody say this, stuck with me one time. Medical marijuana patients are the happiest, hungriest, sleepiest people you ever meet. That's pretty much the side effects that we see from it. It's a little dizzy or tired. You have, is the main thing. Some patients can feel a little nausea when they first, especially if they have just started using medical cannabis. All of these will really resolve for the most part once you get your dosing right, once you use it for a little while. It's really, as far as the side effect profile goes, really, really minimal. The interesting thing, which is, it's one of the big advantages, I think, of medical marijuana from a pharmacist standpoint. There are a lot of drugs on the market that we sell in the pharmacy that treat inflammation, but most of those drugs have a lot of side effects, especially when used over a long period of time. Prednisone is one, sort of the gold standard for an anti-inflammatory. Has a list of side effects for chronic use that's a mile long, from osteoporosis to swelling to kidney, all sorts of issues. One of the number one things we see in nursing homes is GI and stomach bleeding from years and decades of non-steroidal anti-inflammatory use, ibuprofens, naproxens, those sorts of things. So, the good thing we see with medical marijuana that's really unique is that it just doesn't have those types of side effects long term. So you get an anti-inflammatory product here that doesn't have that, really debilitating side effects when used over a long period of time. It really makes it a unique product. So there's just something to keep in mind there as well.
One thing that's not on that slide, Turner. One thing that's not on that slide, nobody's then died from it. That's what every pharma drug out there has this little disclaimer at the end that says, "and may cause death." Okay, this is not going to, you're not going to die from it. You can make it high, okay, but you're not going to die from it.
Yep. So, this was just a study that looked back on a lot of other studies and found that really that 96.6% of adverse effects that were reported from cannabis were considered not serious. So again, just kind of goes to show you the safety profile is really very good with medical cannabis use, short term and long term. Yeah. So Marc, I will give this back to you. I have finished my little section of it here, and see if I can.
You want me to take the slide sharing from there? Huh? Okay.
Yep. Yeah, you can take over from here.
So the reason I put this slide back in here is I want to be able to go back. We want to answer some questions, but before we jump into the questions, we brought up some things. Common feedback. It didn't work, so I quit. In many cases, people started using it. Let's say they started with a 1-to-1 product, and they took 25 milliliters of it. That's the first line on the eyedropper, and it didn't work. So they maybe went to 50, and that really didn't work. So they quit. And so what's happening is you got to find out where your tolerance to THC is, how your body reacts to CBD, you may not be taking enough of it, is what I'm trying to point out. And so if you don't do that, it's not going to help you. And then also the other side of it, like in the case of my wife is very tolerant to she is not very tolerant to THC. So even for her, a 1-to-1 product got her a little bit high. But as we went to what they call a 4-to-1 product, which is 4 CBD to 1 THC, that really helped her quite a bit. In fact, what she takes right now is a 12 CBD to 1 THC product, and that's her basically that's her sweet spot. So it was a matter of just trying different. We knew the tolerance level had to be low for THC, but as we increased the CBD levels, that's when she started getting the benefits that are out there. So I think that's one of the things.
Yeah, well, and really and two, I just to say, really one of the big goals I think the reason I do these dosing seminars is that I don't want people to give up quickly when they start the medical cannabis program, because it is, a lot of people go in with the expectation, well, the first thing I try is going to work, or the first, and they may have a negative experience that first time, whether it be too little or too much, and just don't give up on it. It does take a while to adjust and find your dose. It's a little different way to think about medication, but it doesn't mean it won't be effective once you work with it for a minute and just be patient and just try to find your right dose, because a lot of people have really missed out, I think, by giving up on it too early, and it's something they really could have improved their quality of life, but because of the uncertainty up front, they just didn't give it enough time, and so really just wanted to stress that don't give up, on it first thing. So.
Yeah, I mean, it's not that it doesn't take like a year. I mean, in my case, it took to find out. I found my effective. It took me about 2 weeks to find out where when I was on the dartboard, and then candidly, it took me about a month to get the sweet spot, to get to the center of the dartboard. So and
that's typically what we. Yeah, that's typically what we see, about a month to 8 weeks, or to 6 weeks rather. Define the dose, adjusting every 2 weeks to sort of tweak where you need to be. But just go in with that expectation that it won't be, typically most patients don't get the exact relief they want from the first time they use it. So.
Right.
Being a medical marijuana patient, you have to have some patience sometimes when trying to find your dose.
Yep, absolutely.
Stick with it, and be honest with yourself about it too. If you are having those adverse effects and you don't feel good, take it back to Trulieve and exchange it out, and keep working with it until you find something that really suits you and works the best for you. Yeah,
exactly. That's important. It will work. Just finding the sweet spot, and this isn't take 2 pills and I'll see you in the morning type of thing. This is something that's more like you'll work on it, but the benefits of getting your life back. I could not live on a daily basis without medical cannabis. My pain level would be too high. I'd be I'd be an irrational animal. This has really helped quite a bit. So it's very, very important. One of the other questions is people say, I got high, so it was such an uncomfortable experience, I either quit or I'm thinking about doing something else. This happens a lot where people have to take a product, like for example, if people looking at cancer, and they're looking at a very high THC product like RSO oil, and all of a sudden they jump into a high amount of RSO oil when they don't have a lot of tolerance for cannabis built up in their body. They can get high. What you need to do in that particular case, before you jump into a full RSO regimen, is really try some 1-to-1 products. Build it up. You can find what that ratio of THC to CBD is, and then find a RSO product that actually. There are RSO products that have quite a bit of cannabis, of CBD in them right now that can help quite a bit. So it's a matter of if you jump right into it, you may get very high, and that's something that some people just are uncomfortable with.
And when you mention, using RSO, Marc, one thing that we tell every patient is just start low and go slow.
Right.
Don't overdo it. Start with the minimal amounts. If you're talking about RSO or any of those extractions, definitely start as a quarter grain rice size. Start low and go really slow. Have it be on a day that maybe a Sunday where you're not going to be doing much around the house, or you can take it very easy. Set yourself for the environment to have the best experience with it.
Yeah, well, you can experiment with it a little bit. I mean, you do have to be able to test what works and what doesn't work, and how you feel with it. My experience took me, like I said, about 6 weeks to really find my sweet spot. but it's made a huge difference in my life ever since. So again, it's not taking 2 pills and I'll see you in the morning. Again, if you are getting high, that's what the CBD oil is there for. And again, take advantage of Trulieve. I think Trulieve's done a great job of being able to exchange the products, and that's something it not only helps your pocketbook, but it also helps your body get the right products there.
And one thing that we'll be highlighting when we get into the product aspect of it is we've also expanded our ratio lines as well. So we have a lot of ratio products for those new patients who might not be, as experienced with cannabis. So you're going to find a lot of options where you can really, really work with these routines and find, like I've been saying, exactly what works for you and your conditions.
Right. One of the other, I think also one of the questions that people come up with is, I'm taking it, it's working, but I wanted to get more benefit out of it. In other words, it's not completely addressing my situation. I have a gentleman I was talking to, and he said, yeah, I take it, it's helped my pain, but it really hasn't got my pain level down to the level I thought it was. And I worked with him over a period of about a month, and we adjusted the amount of CBD to THC. We adjusted the CBD level, increased it a little bit, and actually introduced some CBDA and some THCA into his routine. And it worked for him. It got to the level where he wanted to be. And that's where having somebody who can help you with the right product really makes a lot of sense. For example, working with your bud tenders at Trulieve.
Definitely. They're a wonderful resource for sure. Right. And again, just how individualized, your cannabis care plans can be, whether you're adding in, products that have a high CBG content or higher CBD or CBN on those cannabinoids. There's a lot of flexibility within it and a lot of individualization. So it's just really important to, like I said, take journals, take notes, pay attention to how your body's reacting to it, and work with those bud tenders, work with the associates we've got there. They're trained for it, and they love having those discussions. So, and all questions are welcome.
One of the other things that I think people don't realize is that like, for example, Trulieve, you have a consultation service. You can go online, you can sign up for a consultation service. It's just like telemedicine. You can do it, through a Zoom call like this, and they'll really help you identify which Trulieve products can help you with your particular condition.
Yes, it's completely complimentary. You don't even have to be a medical marijuana patient. If you're just canna curious, as we call it, you can schedule yourself an online virtual consultation. It's done from the comfort of your home or wherever is convenient for you, and it's a one-on-one 30-minute session with a trained consultant who can walk you through the basic questions of what is THC versus CBD, all the way up through different extraction methods and building out those care plans for you. So those virtual consultations are right on the website, and you can schedule them at any time at your most convenient time. So they're a wonderful resource.
And I'm going to throw a very big compliment to Trulieve. You're the only dispensary that not only has the consulting, but also you exchange the products.
Yes. And like we've been saying, each patient interacts with the product so differently. And, you might get home and you might hit that vape pen and it doesn't give you the relief that you need. You might have an adverse reaction, and we're here to help the patients and to provide as many resources as possible. And part of that is working with them on these routines. And if you just take the product back, explain what happened, it's an exchange. They'll swap everything out for you, and you can find something that really does work for you.
Sure. And then one of the other things, I have some friends who said, well, I just smoke a joint and I'll get all the relief I want. Well, there's kind of there are two comments on that one. One is, I guess you can, if you smoke a joint or strong enough, it's like taking 151 Bacardi, drinking it straight at a pool party. You'll get to where you want to very quickly. Not sure you'll enjoy it, but you're there. But I think the real issue boils down to what Turner was mentioning earlier about terpenes and getting the right terpene profiles. To be blunt, you don't know what the terpene profile is of what you're smoking. And so if you need something, for example, that's really good for you with respect to relaxing, like some Myrcene or some linalool or something like that, or caryophyllene, that's something that you may need that can really help you with the terpene you're looking for. But if the joint you're smoking doesn't have much of it in it or any of it at all, it's not going to help you at all. And one of the things that really I really caution, especially veterans, be very, very veterans and people with PTS, people that have had a traumatic experience. What you want to do is you want to be very careful with pining, because if the cannabis you're smoking has pining in it, you'll have exactly the opposite effect of what you're trying to affect. So knowing what's in your product is absolutely critical to getting to the relief that you need.
Definitely. And one piece of that we provide at Trulieve as well is those lab results. So if you look at any of the products that you purchase at our dispensary, you can use the SKU numbers or the unique identifiers for each of the product. And you can actually go to the bottom of the page, you click lab results, and you're going to input those numbers there. And you're going to have something populated that shows you a very detailed outline of everything that's in your product, from the terpene profiles to the cannabinoid profiles to the date that it was actually grown and taken from the pots. So we provide all those resources for you so that, again, you can start building out these plans, keep track of the journals, pay attention to those terpene profiles. And if you are getting true flower through us, you can go and see what those terpene profiles are. So if you're looking to smoke a joint, you can actually start to play with those terpene profiles and look at those lab results. So it's really fun once you start getting into the science of it and see exactly how it affects your body. So
yeah, exactly. And also the other comment is I don't know where to get help. Well, first of all, webinars like this help. Getting consultation from people like your dispensary, like Trulieve, I think that's a good resource. Your doctor, MMTC. I know if you have got your medical marijuana card from MMTC, they have a dosing center. You can call in and get assistance with your dosing. And then also, if you're not an MMTC patient, if you didn't get your card from them, for $49, you can transfer over to them and take advantage of the dosing center. So there is resources that are out there. And we'll be detailing that in the follow-up material. But you're not on an island by yourself. It's just that they're not well known of what's out there and what's not out there. So what I'd like to do is I'd like to go back and maybe tackle a few of the questions if you don't mind right now. Turner, you want to take a few of these? What would you like to do? How do you want to handle this? Let's start with the top one. It says, I use a CBD patch to control anxiety. It really works great. It cuts my anxiety. After being there, that being said, are there any CBD products? Go ahead.
Do we want to let Sarah go through her slides here before we start the Q&A, or?
Either way, you want to do that?
Yeah, let's do that first.
Okay, super. Sarah, why don't you go through that, and then we'll because we may answer a lot of the questions with your slides.
Yeah, perfect. And if you want to control on your end, Marc, feel free to click to the next slide.
Sure. We're going right here.
My technology is a little finicky tonight. So just a quick little background on Trulieve. We are the largest in the state, the largest medical cannabis provider in the state at this point. We do have 86 dispensaries that are online now. We just opened with Crystal River and then Lynn Haven last weekend, and we did just have our 5-year anniversary. So we are servicing the largest amount of patients in the state. And one thing that I heard the other day is at this point, Trulieve is now within access of, I believe, a 40 to 50 minute drive of most residents in the state of Florida. So you're going to start seeing a lot more accessibility. One of our biggest initiatives is just to provide as much access as possible for those patients. So if you have a location near you or you'd like one, throw it our way, and we'll try to get you as much access as we can.
Cool. So, but you have a nanotechnology that's very interesting.
Yes. And so as Turner was mentioning earlier, and we've been discussing, adding in CBD and THC in that regimen is going to be really, really important to maximize your relief. And we actually do have true nanotechnology that we have across several different products. The first one is going to be our true nano tincture. We have it in a 1:8 CBD to THC, and then an 8:1 CBD to THC. Marc, you mentioned that your wife is using a higher CBD to THC rate.
Right.
Having just that smaller regimen of THC is what's really going to maximize the pain relief for that. And so with these true nano tinctures, you're looking at a full dropper is going to be about 0.44 milligrams of CBD for the 8:1, and then it's going to be 0.06 milligrams of THC for that 1:8, and then it's going to be reversed for the opposite side. So obviously, if you're looking for something that's going to give you more euphoria, more higher pain relief, get a more traditional THC experience, this 8:1, the 8:1 is going to be the best option for you. The one with the higher THC content is going to be the best. And those are just $55 for those tinctures. And true nanotechnology, actually, it increases your bioavailability. passes through the blood-brain barrier, has a quicker onset for you, and it's actually achieved through sonication. It's a high frequency vibration that we use to break down those molecules. So inhalation will always be king as far as instant relief that you can achieve, but nanotechnology is going to be the next best thing for you. So you're going to start feeling those relief, the symptom relief within 15 to 20 minutes typically for onset there. And then we also do have our nanotechnology with our true nano gels as well. So that's going to be kind of a traditional edible in the sense that you're used to, gummies, if you will. And those are very easy to dose. It's a controlled dose. So they do come in 10 milligram, 10 pieces for a total of 100 milligrams in the bottle. And they do come in indica, sativa, and hybrid for those nano gels. And they're just $25. So extremely cost effective. And with the nano gels, you can also cut those in half too, to start with even lower doses if you wanted to as well. So you can really build up with those. And with it having nanotechnology in it, you'll be able to determine really quickly, what that level of comfort is for you. Whereas the traditional edibles, it takes about an hour and a half for onset. With nanotechnology, again, you're looking at 15 to 20 minutes.
Right. Oh, we'll go to the next slide. There you go.
Yeah. And then again, just wanted to highlight the amount of ratio products that we are rolling out now at Trulieve. And I know that we have so many new patients coming online. I think the last I saw, we had over 500,000 patients registered in the state of Florida. And so it's really imperative that we provide these products for these new patients. And so one of the first products and one of our tried and true products, if you will, is going to be our True Clear. True Clear is an extremely versatile product. It's easy to dose. The syringe itself actually has the dosing labels marked, but you can use it orally, you can use it sublingually, traditional inhalation as well. So it's extremely versatile for patients. You can use it across multiple routes of administration. And it is always available. It is one of our tried and true products. And so it's going to be that one right there in that syringe. Right. You can put it into you can cook with it. You can put it, it's an extremely versatile product. We also have that in ratio forms as well. So that does have a 1-to-1 option, as well as just your traditional high THC options. Right. And then a level from that is going to be a True Pod that actually has the True Clear in the True Pod itself in a form of vape. Thank you for highlighting that, Marc. And I know that you're a big fan of our 1-to-1-to-1 Laughing Buddha. If I'm ever in an auto accident, they'll find one of those in my pocket. I carry it with me all day long. It's a vape pen I use in the morning. It's a vape pen I use in the evening. The 1-to-1-to-1, I really like the Delta 8, Delta 9, and CBD ratio. It's in my opinion, and this is after, again, I had a knee replacement, a total knee replacement about 2.5 years ago. And I worked with the doctors over at Jewett Orthopedic. And one of the things that I did was I decided that I wasn't going to use pharma drugs once I left the hospital. So on Monday, I was operated on, used it. Tuesday, I used it. I had to. Wednesday, when I went to check out, I took no pharma drugs. And by about noon, I was in pain when I was checked out. And I literally went in the parking lot and took some of the tincture drops, but I also took a couple hits out of the 1-to-1-to-1. And literally, by the time we went from the parking lot to the street, my pain was down, went from a level 9 down to a level 1. Yeah, it's
pretty how fast it works.
It's pretty incredible how instant, inhalation relief is. And with Delta 8, you have less psychoactivity as well. So it's really great for daytime use, which is, why I'm sure that you're able to use it as soon as you wake up to get that instant relief. And with it having that CBD profile in there as well, it just adds to the inflammation, the pain relief, the anxiety reduction for patients. That is really going to be a really great daytime use product for you. Anything with Delta 8 is going to be a great option for daytime use. And again, Delta 8, similar to CBD being found in other, outside of Trulieve or outside of MMTC, for example, it's a quality question. So if you see Delta 8 out and about, be sure to ask, where exactly is that product coming from? So with Trulieve, you have access to healthy, clean, quality Delta 8, Delta 9, CBD, CBN products. So
and that's a good point. I mean, you really got to know where you're getting your products from.
Exactly.
But I can tell you, you're right. The Delta 8, CBD, Delta 8, and in my case, because I have so much pain, Delta 9 makes a huge difference in my life.
For sure. And with Delta 8, because it's less euphoric, you're getting all the benefits of, Delta 9. So you're getting the pain relief, the reduction of inflammation, and it lasts the same amount of time, but you just don't have to worry about the psychoactivity or the euphoria. If you're looking for relief without that heightened sense. You can definitely find that with Delta 8.
Right.
And then we also
just one point real quick on the Delta 8 for patients. One thing to be careful about on the Delta 8 is when we're talking about inhalation versus edibles on the Delta 8, it is true that the inhaled versions of Delta 8 are very non-intoxicating and have can really help with pain. Just be careful with the edible versions of Delta 8, and even the over-the-counter CBD Delta 8 can cause intoxication due to the fact that it is converted to that 11-hydroxy THC in the gut, just like Delta 9 is. So, just be careful with your dosing on that if you're starting out on it in an edible form. Again, with inhalation, it stays in the Delta 8 form, so it works great. With when you take it orally, you do have to be a little more careful because actually the intoxicating effects can be a little more increased. So just something to keep in mind there.
That's a good point.
Thank you for providing that insight. And anytime that you're ingesting is going through the digestive tract, just know it's going to be a different animal. Usually,
Sure.
it's different altogether. So thanks for adding that in. And then with the TruPods as well, we do have just a traditional 1-to-1 CBD to Delta 8 ratio product as well. So if you don't want that Delta 9 aspect in there, we do have that. And then with our TruPods as well, we have them in all of our strain specific cultivar collections, all the traditional strains that you've come to know and love with Trulieve. But I just wanted to highlight those that have that CBD or Delta 8 addition to it. And then with our traditional vape cartridges, we also have everything from 1-to-1 ratios. One that I'm really enjoying is our 5-to-3 Mother of Dragons. That's going to be a CBD to THC option. And then we also do have those 8-to-1 and 1-to-8 through Sunshine Cannabis as well for that CBD to THC ratios. And again, all these vape cartridges, that's going to be your instant relief. When you're feeling that immediate pain, these are going to be great options for you to have in those moments. And then moving on to, those longer term relief products that we have, moving into True Gels. Again, we have 1-to-1 CBD THC, which is pretty traditional. We also have a new product. It's a 5-to-1 THC to CBN. We touched on CBN a little bit earlier on, but it is another cannabinoid that more and more research is coming out about, and it is a great sleep aid. It is essentially the intentionally aged portion of THC. Once THC oxidizes, it then becomes cannabinol, and cannabinol studies have been shown that I have some patients who have been insomniacs for years who are now getting full 7-8 hours of sleep every night. And it's because CBN is such a heavy sedative. So that is a great product for a lot of patients. And then we also do have 1-to-1 CBD to CBN as well. So if you're a patient who, maybe you're doing your vape pen and you want to have a CBD, CBN sleep addition, this would be a great option for you too.
One of the things I do want to point out is if you look at this picture here, you see these little gels that are here. Yep. The state of Florida kindly made sure that every gel looks alike. It doesn't make any difference what kind it is, doesn't make any difference the flavor, doesn't make any difference the ratio. They wanted them all to look the same because they were worried about kid safety. Yep. So I know that when I first got some gels, I thought, well, raspberry would be red. Well, it's not red. Okay. So just be aware, something's not wrong. State of Florida is kindly making sure that we have a common looking product so the kids don't get involved in it. And so it's also very difficult. So if you have a couple of different kinds, it's hard to mix them up. You don't know what's what. Yeah. That's the other issue.
Yes, that's one thing that you'll notice just with the regulations being what they are in Florida is a lot of the marketing and the products are very regimented, and they're very universal. So all of our gels look the same, all the capsules, so it's just part of the regulations in Florida. So definitely just make sure you keep keep everything separated if you can. Sure. To keep track of it. Because if you're taking a true nano gel and you're not expecting it, it could be a little different experience for you. So, and then lastly, we do another thing I wanted to mention with true gels as well is we also have sugar-free that we've rolled out too. So if you have any patients that have dietary restrictions, we do have sugar-free options as well. Again, we're just expanding our product line and really trying to provide as many options for as many patients as possible. And then just to expand on that, we do have capsules as well. You're fine. Not a problem. Our capsules, we do have them in 10 milligram options, 25 milligram options as a 1-to-1 ratio. So it's going to be 25 milligrams THC to 25 milligrams CBD. And then we do have them also in 50 milligram options. And so the great thing with our capsules is they come in a 30 count. It comes as, it's essentially already designed for you to add into your care plan. So you can do a low dose of 10 milligrams. You can do a 1-to-1 ratio of 25 milligrams, or you can go higher with a 50 milligram. And it's going to be available in indica, sativa, and hybrid, and a ratio, obviously, and CBD and CBN. So plenty of options for you there across the capsules.
Sure. Now, the nice thing about it is you deliver.
Yes, we do. We have free statewide delivery for patients over 65. And then we also do have same-day delivery that is just dropped as well. So if you're within a 10-mile radius of a delivery zone, you can also get same-day delivery as long as the order is placed before noon. And then we also do have our traditional order pickup in store, as well as traditional walk-ins as well. So plenty of ways for you to access your Trulieve products now.
And then you have plenty of discounts.
We do. We have loyalty discounts. We have veteran discounts. We also have, when the first time you come into the dispensary, you're going to get a discount, as well as 15% off your next order. And then, yes, I love that we also rolled out our industry discount as well. So if any of you on the call are in the medical cannabis industry or work for a physician's office, you do have an industry discount now as well. 20% off on Trulieve Tuesdays.
Right, there you go.
I saw Turner peek up.
We're all ready to go. So listen, so I didn't mean to cut you off, but you've got the discounts, you've got the delivery, and what I think, again, highlighting, you can bring the products back, and I think that's really important.
Definitely. If at any time anything does not work for you as expected, or the relief that you're looking for, bring it back, exchange it out, and find something that does work for you. We're very flexible on it, and we're here to help in any capacity.
Cool. So Turner, you want to jump into some questions?
Yeah, let's do it.
Okay. You want to start at the top?
Yeah, so let's see. First question, using a CBD patch to control anxiety works great, cuts anxiety by 50%. That being said, is there a CBD product that I can use for breakthrough anxiety? I do not smoke flower, vape, or use THC. So, yeah, typically we would recommend, like we mentioned, that full spectrum CBD products. Again, they do have a very, very small amount of THC in, less than 0.3%, which is not going to be enough to feel or to get any intoxication off of, but it does enhance the effect of the CBD and the other cannabinoids in there. So, if I were you, probably just a tincture, a dropper bottle with, full spectrum CBD that is from a reputable maker. Again, we, if you go to the My Botanica website, like we mentioned, we do have those physician reviewed products on there. But yeah, that's probably the way I would go with it, just to get the maximum benefit from that.
And I should point out, the move patch is great. It's CBD, but it's only CBD. It's a broad spectrum product. It doesn't have any THC in it at all. And you need a touch of THC to be able to help with your anxiety. And so that's where a 1-to-1 ratio, or looking at some other formula, is set up to be able to do that.
So let's see. The next question from Russell here. I have I take my 1-to-1 tincture early in the day for back pain. Lost it there. I have difficulty with my blood pressure dropping to 80/40 from my normal of 106/68. Do you have any suggestions for this? So yeah, this is a phenomenon that's been identified, especially in older individuals recently. I think the first article on this was like in February of this year. They started seeing this phenomenon a little bit. Typically, it's the THC that's causing the drop in blood pressure. The interesting thing about this is that they found that when laying down, you don't have the THC doesn't cause the drop, but if you take it standing up, then it does for those individuals. But probably what I would recommend on doing that is just switching to a higher CBD ratio product at 4-to-1. Maybe take since the effect is not the same when you're laying down, you may take the 1-to-1 at night and then take a 4-to-1 during the day. That may be a good recommendation for you, and just sort of monitor your blood pressure from there. But again, that's just a genetic phenomenon that some people seem to have with the THC there and the blood pressure dropping. So.
And by 4 to 1, you mean 4 CBD to 1 THC. That's the ratio.
Correct. Yeah, 4 part CBD to 1 part THC. Correct. Yep.
Right. So again, this is individualized. It has to do with your body, and maybe going to a 4 to 1 will help quite and help with the blood pressure issues.
Yeah, exactly. And for the pain side of it, if you still need that 1 to 1, if you are going to take that, like I said, that for some reason it doesn't seem to have the same effect when you're laying down. So maybe use that at bedtime as a little bit higher THC product to kind of keep the pain sensations under control. So.
Yeah. We've already had a question about, can CBD help with shingles?
Yeah, so yeah, can CBD help with shingles for pain, topical oral, no vape or smoke? Thanks. Honestly, for neuropathic pain, which is what shingles is, or post-herpetic neuralgia, which is a condition that forms after you have shingles, it could hang around. It comes from the nerves, so the CBD really doesn't help a lot with that. It may help a little, but the combination product, you're gonna really need some THC to get significant benefit from a neuropathic type condition, whether it's peripheral neuralgia or peripheral neuropathy rather, or that post-herpetic neuralgia from the shingles. The THC is going to play a very important role there. So probably the CBD is not going to give you the relief that you would want from that.
You're going to need probably a 1 to 1 type product to be able to address that type of pain, or at least start with a 1 to 1.
Yeah, for sure.
So Viola.
All right. So next. Yeah. So this is from Viola. I was just wondering how you handle the question. I believe in the medicinal effects. My spouse has cancer, muscle spasms, and can't sleep. He just got his card, and I am trying to help him. As a chemistry teacher, it's different, so he needs the Delta 9 THC. I guess the question here is, the spouse may be reluctant to use the medical cannabis, and usually the best thing to do with that I found is to start someone off with a high CBD, very low THC product, and let them get see that it is the sensation is not as scary as they think it's going to be. They will get a little bit of relief from the high CBD, low THC, and then slowly kind of work their way up, in a rate that they're comfortable with. But especially for those sorts of those conditions, the cancer, spasm, and the insomnia for sure, I can't stress enough how big of a difference medical cannabis can make on getting a good night's sleep. It creates a much more natural sleep pattern because of, our body uses it anyway. There's endocannabinoids to sleep. So you get a much better, much more complete night's sleep when you use those medical cannabis products, which by itself can really help alleviate a lot of conditions, a lot of anxiety just by getting a good night's sleep. So yeah, for sure, with him minimizing the THC, saying, hey, we're really going to try, even if you start off with a full spectrum CBD product just to show that, hey, look, it does help you sleep, then maybe move on from there, whatever he's comfortable with. But yeah, he definitely would benefit for sure with those sorts of conditions. So.
Yeah, and he's going to need with the muscle spasms and the cancer, he's going to need some THC to be able to address those situations.
Yeah, it's just getting over the objections and the mental sort of block there. Starting with a lower THC product may be the way to go, just so it doesn't scare them off first thing. So
yeah, but again, introduce him into something that has a higher ratio of THC, because that will address his situation, both from the standpoint of addressing the cancer and muscle spasms, but also the pain and inflammation.
Yeah, certainly in that situation, the goal would be to increase the THC level over time, as he's comfortable with it. But yeah, definitely want to start off, if he's resistant or if he's hesitant, start off with the higher CBD. So.
And a good option might be the True Nano tincture, the 8 to 1 that I mentioned earlier.
Yeah.
Got that high CBD profile, a lower THC profile. It's got enough to kickstart the pain relief for him. So that might be a really great option.
That's a good point. That's an excellent point. Yeah. Good point. And then move from there, right? So Carolyn was asking, or Catherine was asking, can CBD help cure cancer? Turner, what's your comment?
Well, there's anytime we talk about curing something, there's got to be, there needs to be a very high bar of evidence before we use that term, especially with something like cancer. Certainly, there have been studies out there that show, effect on, in the lab of cannabinoids on cancer cells and their ability to perhaps kill cancer cells and things like that. I have not seen a study that has shown definitively that, CBD or RSO oil makes a difference in reducing cancer. It can certainly help reduce the effects of cancer, but on the cancer itself, there's certainly anecdotal stories out there about it, but from a placebo-controlled double-blind study that really takes all the placebo and accounts out of it, I have not seen that, so I'm hesitant to really go that direction. But I can say for sure that as far as symptoms go, certainly both can help.
Yeah, I mean, the problem here is we're suffering from the fact that cannabis is a Schedule I drug, and there hasn't been enough research done on it. Now, there is research that's been done by Dr. Cristina Sanchez in Spain. She has a lab that for 22 years has been studying cancer and cannabis, and she's done some studies over there, and she's published them in PubMed. And of course, Rick Simpson, RSO, Rick Simpson oil. Rick is published in, his formula, and he's got Phoenix Tears has a lot of people that you mentioned anecdotal. You've got people that have basically claimed that it helps. So the problem is we need to get rid of this Schedule I, and we need to do some research. I believe there is some where there's smoke, there's going to be fire. So where you see the anecdotal evidence of cancer being able to help, I'd like to be able to really nail that down and be able to be more definitive about it. But at this point in time, I really can't. But I can tell you, if I had cancer, I would seriously look at things like RSO rather than nothing. Let's put it that way. If you have an option, head down that path, because you know what, the other option isn't good. Doing nothing isn't good.
And RSO is one of those products that I have a lot of physicians who are using it to work with opioid patients because the relief and the effects of it are just so potent. So it is we have RSO at Trulieve and Indica, Sativa, and hybrids, and we work with many cancer patients who use it as their daily relief option. It's a wonderful product. It's a whole plant extract, so you're getting all of the cannabinoids, all of the terpenes in one little syringe. So it's very potent. You get very wide range of relief from a very minimal amount. So wonderful.
I mean, I have a personal situation where my mother was diagnosed with cancer 4 years ago, and we put her on RSO rather than surgery, and she's still here now. She's 93 years old, and she's like the Energizer Bunny. That's the problem. I mean, she went from I don't feel very well and I'm going to be dead in a month to walking around the block 5 times. But from an anecdotal standpoint, there's some evidence that's out there. But again, it's hard to say because cannabis is so personalized for every particular person. There is no, take 2 pills and CBD in the morning type formula. And unfortunately, that's the case. We need to get more research to be able to nail that down. Bernie, want to take another question?
Yeah, so I got one from Deb here. She found her sweet spot with a specific product line, but the company pulled out of the dispensary and had not been able to find it anywhere else. Tried other dispensaries, but cannot find the same ratio that works for me. With that, Deb, if you're still on, I would just, email us maybe with some details after with the ratio, and I can see what we can find for you. I'll run it by some of our call center staff and see what we can figure out for you there and get back to you.
Sure. You can send an email to event at marijuanaaware.com or events@marijuanaaware.com, and we'll get that email over to Turner.
Yep.
Feel free to schedule.
I got an anonymous. Got an anonymous attendee. What about online sites like Charlotte's Web in Colorado? Is that a good place to get your CBD? Yeah, Charlotte's Web is certainly one of the more funded places. They certainly would probably be one of the safer places to get the CBD. But again, just make sure if you're looking at a CBD product that you're make sure they have lab work to back it up and those sorts of things to make sure you know what you're getting with that. So I'll move on to Maryland's here. Do you think medical marijuana will ever be covered by insurance? Yeah, I mean, eventually I think there will be products out there that will be covered. You know, the first thing that's going to have to happen is it's going to have to get off of the Schedule 1 status by the DEA, which, you know, again, shows that there's no medicinal value to medical marijuana, is what Schedule 1 means. Gives the insurance companies a reason not to pay for it. But the other challenge with insurance is you know, what is medical marijuana? What product are we covering? You know, so there'll be a lot of work that'll need to be done by companies like Trulieve to standardize a product, you know, or products to be covered by insurance. So, you know, that individual variation that we've talked about throughout this presentation is really the challenge with medical marijuana, and the fact that, you know, if your insurance covers a 30-gram bottle or a 30 ml bottle of a particular type of oil, what's the dose supposed to be? You know, how much are you supposed to use in a month? How much, you know, those sorts of things. So that's the challenge that we run into with those sorts of insurance issues. But I imagine there will be some sort of, you know, it's too big, it's too prevalent at this point for there not to be some momentum in that direction, but there are still challenges in the way.
A lot of the bills that are being presented federally, and I'm not going to make too many comments because there's different bills and different variations, so there's not a standard on that. But they all open the door for cannabis to be covered by insurance companies. Again, that's going to be a process. It's not going to be done right away, but the door is clearly the door is being constructed, if not cracked open. Let's put it that way.
All right, Denise had a question about RSO. We kind of discussed that a little bit. So Viola had another one here. What tincture or edible would you?
RSO is Rick Simpson oil.
Is that, yeah, just what it is. I'm sorry. Yeah, what is RSO? I see. Yeah, that's what
RSO is Rick Simpson oil. Yeah. If you look it up on Google, you'll be able to find Rick Simpson. He contributed that formula to the world, and so and a lot of people, a lot of pharma companies want to get rid of Rick Simpson because he's had so much success with it. He's living in Europe right now. He is alive. He isn't working in Europe. And if you go to a place called Phoenix Tears, you'll be able to see that you'll get plenty of information on it. But I would look it up. That's what it means, and it's effective for a lot of people. I know it's helped my mother. It helps me in certain cases. So it's something to really pay attention to. I think, Sarah, you've had some positive. It's something you guys cover, and you have some very positive experiences with it, right?
Definitely, RSO.
Yeah, no.
Yeah, I was going to say RSO is one of our most popular products with cancer patients, and again with physicians who are working with former opioid users as well, weaning them off of those. You know, RSO is a wonderful product. It's a whole plant extract. So again, like I mentioned, you're getting all the benefits of those terpenes, all the cannabinoids, in one very easy to dose concentrate there. So I'm a huge proponent of RSO if you need it.
Cool. So Turner, Viola had a question about tinctures and edibles.
Yeah, what tincture edible do you recommend for healing after 6 surgery, secondary condition to my spouse's prostate cancer? He has inflammation, muscle spasms. You know, really, again, I would start him off at the same way we would start off any of the patients with a 1-to-1 product. You know, probably a higher concentration, probably 30 to 50 milligrams in there, and kind of see how he responds and adjust from there. You know, the edibles, Sarah, what would you have? What does Trulieve have in that sort of range of edibles and tinctures there?
Absolutely. So we have the traditional true gels that I mentioned earlier that are, it's going to take about an hour and a half for relief or onset. They come in 10 milligram doses, individualized doses there. If 10 milligrams is a little much, if you want to start lower and go slower, you can cut those in half down to 5 milligram or even 2.5 milligram if you wanted. Just keep in mind that with those traditional true gels, it will take about an hour and a half to 2 hours for full relief to kick in. If you're looking for something a little bit closer to that instant relief, we do have the nano technology in the true gels as well. The true nano gels is what they're technically referred to as. So that's going to be another great option if you need that instant relief. Again, those are in 10 milligram serving sizes. You can break those down We also have them in sugar-free too. So plenty of wide range of options for you from that standpoint. And then other traditional edibles that we have brownies, we have cookies. So we have a lot of different options for you there. We do have brownies and cookies also in 1-to-1 ratios. And then for tinctures, I would also, like I mentioned previously, that 8-to-1, the higher CBD to a lower THC content, and those true nano tinctures are going to also be a great option for you guys to use too. If the 1-to-1 gives a little bit too much euphoria, too much psychoactivity, scale it back, go higher on that CBD option with that tincture. Those would be my personal recommendations.
One of the things that I always find, people ask me, what should I do? They're looking for a canned answer. What should I do here, here, here? And the answer really isn't, what should I do? Your body will tell you what works for you. Listen to your body. That's really the key, because there is no canned answer that's out there. As Sarah was mentioning, try some edibles. Start with the 1-to-1s. Try the different ratio products, okay? After a couple days or maybe a week or two, then maybe throw in an edible. So try different things. Your body will tell you what's going to work and not work. No one can give you that formula. You're going to basically find it yourself, but it's something that can be found, and it will help quite a bit. And there's products, as Sarah mentioned, that are out there that you can try that'll be able to help you be able to accomplish the goal that you're trying to reach, which is basically being pain-free and hopefully helping to relieve a lot of the symptoms.
All right, and the last question from Kelly here. Would you explain Delta 8 versus Delta 9? Yeah, I know that can get a little confusing. That's a chemistry term that we use just to identify two different forms of THC. So it's the position the carbon molecule is on the overall molecule. You know, is it the 8 position or the 9 position? So, you know, that particular differentiation. The important thing to know is they're just slightly different in the way they behave in the body because of the way they're shaped, and that's where that Delta 8, Delta 9 comes from. So, you know, they're both THC, but they just have a little bit different shape, so they behave a little bit differently in the body when they're, especially when they're inhaled. So.
But I think that the Delta 9 products can have more of a euphoric effect than
Correct.
The Delta 8.
Correct.
That's what the main difference is there.
Yep.
Well, I think we've answered the questions, and this has been a very long webinar. It's almost 2 hours, so maybe we ought to kind of wrap it up. So let's start. Sarah, you have any comments? You want to have any closing comments you want to give us? And by the way, thank you very much for sponsoring and for your comments. I think it's important for people to understand there's a place that you can go to get help, to exchange your products, and it's local. So yeah, thank you.
Definitely happy to be here, and thank you so much, Marc and Turner, for having us. And you know, for the patients, again, we're just here to be a resource and to help you in any capacity. So if you ever want to schedule a virtual consultation, please go online. We're here to help in any capacity possible. So thank you all for being here. I hope it was informative, and if you ever have any questions, reach out at any time. We're just here to help.
Super. Turner, you have some closing comments?
No, I just appreciate everybody hanging in there with us, and hopefully everybody took some new information away. And yeah, appreciate you having me, Marc.
Thank you. Well, both Turner and Sarah, thank you very much for your contributions, but more importantly, I want the viewing audience to thank you very much for attending. It's been a long webinar. I know a lot of information. You'll get follow-ups so you can see the videos, see the questions, see the answers, and be able to go from there. We're trying to make it as easy as we can. As I mentioned at the beginning of the show, my goal is to be able to have one person every day get their life back. We have a program we call I Got My Life Back. We have a testimonial site for that. And that's what we're trying to do. And hopefully if just one person gets their life back from this dosing webinar, we've been successful. And hopefully that's you. Any questions that you have, I put in the comments, in the chat, the email address, the event@marijuanaaware.com. You can send us some questions there. But we want to thank you very much for showing up. Next Wednesday, Chris Cano from Normal is joining me, and we're going to be talking about how medical cannabis works. And then 2 weeks after that will be someone from Trulieve, Alex Ford, will help us with helping us with pain management. And then 2 weeks after that, we're doing anxiety and stress. So please sign up for the webinars. We really appreciate it. Thank you very much, and I hope everybody has a great evening.
Thank you. Thanks, sir.